So today I'm going to be treating the knee using the Tecarpuls from Enraf Nonius. We're going to be using the first protocol, which is the Ilio tibial band protocol. As you can see here, we've got level 8 preloading the heat and 5 minutes. I like to do 1 minute per treatment head size. I'll be using the big treatment head today, so I'm actually going to come up to 7 minutes. We'll come to the view of the therapist. I've put the patient on the side here. This would actually put the iliotibial band under a little bit of tension. Obviously, the lower you have the knee compared to the other leg, the more tension there'll be. You see there on the thermal camera that we're not sitting with a lot of heat at the moment. This treatment can be used on the knee portion of the iliotibial band, mid portion or the upper portion. The reason I've separated them out like that, let's put a bit of contact medium here on the earthing electrode. The reason I've separated them out like that is to do the whole of the iliotibial band in most people would just be too much in one go. There'd be too much space in between the treatment heads, and so you really wouldn't get any sort of build-up of heat. You wouldn't get any loosening off of the tissues. So choose the knee area, the mid portion or the hip area, and actually you could use these settings to do any of these areas. I'm just going to give a demonstration here of a mid portion. So you'll see I've put the contact medium where I want to actually do the treatment. So I'll be doing the mid portion of the iliotibial band. Obviously the iliotibial band is a very large structure, lots of different bits in it. So turn the machine on. I'll start doing my standard circles here. 7 minutes, I'm going to be able to cover a fair area, so most of the mid-substance, but certainly not down as far as the knee and right up to the hip. It's just too much to do in one go, so I'll concentrate on the mid-substance down to the knee. But like I say, you can use this treatment and do the knee section, the mid-section, the upper section at the hip. In my experience with patients with tight iliotibial bands, there tends to be one part of the band that's the main problem. It may well start up at the hip, and that will be the main problem. Once that bit is loosened off, you may then find that obviously you end up moving down to the mid-substance part of it and then down to the knee. Or the opposite can simply be true. You can start at the knee and work your way back up into the mid-substance and then back up to the hip. I don't tend to find that patients have a problem at one area and then it's not into the other parts of the iliotibial band. I like to focus my treatment on the worst part, and as that gets better then move into the other parts of the iliotibial band. I tend to find you get the quickest results and in essence the most effective results from the patient's perspective by concentrating on the worst part first. Obviously, you'd want to do this treatment in conjunction with other treatments, stretching. People like rollering. Some people do, some people don't, to be honest, but it is a treatment that you'll see used a lot. So stretching, rollering, and you can also use manual therapies to ease off the iliotibial band. It's not an area that's commonly dysfunctional on its own. It usually has some sort of underlying problem, often mechanical issues in the foot or the hip. Much more rarely actually issues in the knee, but it can happen. As you see here, I keep moving the treatment around. This is a large area we're covering. 7 minutes, 7 treatment head sizes, a large area to cover. So you don't have to go quite as fast as you would with other areas that you are treating and other areas around the knee especially, where you probably want to move quite a bit quicker than this. So move the treatment head around slowly until you get the heat building up for the patient. That should help to improve the elasticity in the area and the tissues, for want of a better term. And we'll cut now and come back to the end of the treatment. So back at the end of the treatment now, I'll bring the thermal camera back in and you'll instantly be able to see a difference between the beginning and end. You see the large red and white areas showing the heat there. Significant improvement in temperature. That's fairly normal in a large area like the iliotibial band.